Hey y'all, it's Rochelle, Hot Doc Shelly Smith. Hope all is doing well. Today we're going to unveil some more feminine secrets. This week we'll be discussing vaginal health, maintaining a vaginal pH. We'll discuss the most common vaginal infections and also sexually transmitted infections. The CDC has put out a new guideline for treatment of STIs, so I definitely want to review that with you. If you haven't watched the live from Sunday, the meet and greet for the group, please go catch the live because there's a lot of information regarding the group and how we're going to move forward within the group for this month and the education we'll receive. But today we're going to discuss the importance of maintaining vaginal health. So vaginal health is an important part of a woman's overall health. The vagina, as we know, is the closed muscular canal that extends from the vulva, which is the outside of the female genital area, to the neck of the uterus, which we call the cervix. Vaginal problems can affect your fertility, your desire for sex, and ability to reach orgasms. Ongoing vaginal issues can also cause stress or relationship problems and impact your self-esteem and confidence. So I want you to know the signs and the symptoms of vaginal problems and what you can do to protect your vaginal health. Various factors can affect your vaginal health, some including hormones, birth control or feminine hygiene products, sexual intercourse, pregnancy and childbirth, and other certain health conditions and treatments. So we're going to start first with the hormone levels. Changes in your hormone levels can affect your vagina. For example, estrogen production declines after menopause and during breastfeeding. So a loss of estrogen can cause the vaginal lining to thin, that's called vaginal atrophy, making sex painful. For birth control and feminine hygiene products, certain contraception barrier contraceptives like condoms, diaphragms, and associated spermicides can cause vaginal irritation. The use of sprays, deodorants, and douches may cause irritation or make existing irritation worse. As far as sexual intercourse, we all know unprotected sex can result in sexually transmitted infections. Forceful sex or an injury to the pelvic area can cause vaginal trauma. As it relates to pregnancy and childbirth, if you become pregnant, you'll stop menstruating until your baby is born. During pregnancy, vaginal discharge often increases. Vaginal tears are relatively common during childbirth, and in some cases, an episiotomy, which is an incision made to the tissue to help with the vaginal open during childbirth, is needed. And then a vaginal delivery can also decrease muscle tone in the vagina. As far as certain health conditions and treatments, endometriosis or pelvic inflammatory disease, we also call that PID, may cause painful sex. Scoring for pelvic surgeries and certain cancer treatments can also cause painful sex. And the use of antibiotics increases the risk of vaginal yeast infections. So what are the most common vaginal problems? So vaginitis is a common problem, which is an infection or change in the normal balance of the pH, which can lead to vaginal yeast and bacteria, and it can cause inflammation of the vagina. Symptoms include vaginal discharge, odor, itching, and pain. Common types of vaginitis include bacterial vaginosis, yeast infections, and trichomonas. As far as sexually transmitted infections, this can affect the vagina, like chlamydia, gonorrhea, genital warts, syphilis, genital herpes. Signs might include abnormal vaginal discharge or genital sores. As far as sexual problems, these might include persistent or recurrent pain just before, during, or after intercourse. We call that dyspareunia. Pain during penetration might be a cause of involuntary spasms of the muscles of the vaginal wall. The muscles of the pelvic floor can become tense, cause chronic pain and pain with intercourse. And of course, vaginal dryness that occurs with menopause can also cause pain during intercourse. So pelvic floor relaxation, if the supporting ligaments and connective tissues that hold the uterus and the vaginal walls are in place become weakened, the uterus, the bladder, the rectum, or the vaginal wall might slip down. We call that prolapse into the vaginal canal. Some people may say it's a feeling of fullness, like something is hanging out. This might cause uterine leakage during coughing and sneezing, or bulging in the vagina. Some other rare conditions can include vaginal cysts that can cause pain during sex, or it may be difficult to insert a tampon, vaginal cancer, which might first appear as vaginal bleeding after menopause of sex. And there's other rare possibilities too. So we want you to know the signs and symptoms of vaginal problems so that you can contact your healthcare providers in order to have it checked out, okay? So if you have a change in the color, the odor, or amount of vaginal discharge, if you have vaginal redness or itching, vaginal bleeding in between periods, after sex or after menopause, definitely let your provider know. A mass or a bulge inside the vagina, and pain during intercourse. So you may not see your doctor every time you have vaginal irritation or discharge, of course, because sometimes you can, diagnose as a vaginal yeast infection. But definitely, if you treat for a vaginal yeast infection and it does not go away, then definitely that's the time for you to contact your provider to have you to come in to do some screening, okay? So what are some ways to keep the vagina healthy? Being sexually responsible. So, using condoms or maintaining a mutually monogamous relationship with a partner who's free of STIs. If you use sex toys, clean them after use. We want you to get vaccinated to prevent certain STIs. So, like the HPV, we have the Gardasil vaccine to protect against the high risk types of HPV. Those are usually associated with cervical cancer, as well as the hepatitis B vaccine, which can cause serious liver infections that can be spread through sexual contact. Performing Kegel exercises. So you may have heard of these. You can actually go on YouTube and find a reputable source to teach you how to do Kegel exercises properly. But these exercises will help you to tone your pelvic muscle, floor muscles. If you have like prolapse, or if you're the person that leak when you sneeze or cough, leak urine, then this may be something that can help you out with that. In clinic, I also offer pelvic floor therapy, where they go in with a probe, see what muscles may be weakened or those that may be spasming. Use that probe to stimulate those muscles, and they show you certain exercises to do at home as well to kind of help work those things out. So we want you to limit the use of alcohol and smoking if you can. Drink a lot of water. So chronic alcohol use can impair like sexual function. Nicotine may inhibit sexual arousal. So substance abuse may also cause poor physical and mental health, which can also affect sexual function. So we just want you to operate at the optimal level. Regular office visits. So while not all vaginal problems can be prevented, regular checkups can help ensure that your problems affecting your vagina are diagnosed as soon as possible. So don't be embarrassed, and don't let that prevent you from talking to your doctor about your concerns that you may have about your vaginal health. So I know that's a lot of information, but the key is know your body and do the things that you need to do to kind of keep your vagina healthy and to keep you safe. So we will be back on tomorrow. I hope y'all have a good evening. Peace.